Hi, this is Dr. Kaan. Today I'm going to talk about some after surgery considerations for your ACL reconstruction, some tips that I like to inform our clients as they're getting ready for surgery. So before I get into that, guys who've been following along with the page, please subscribe to the channel. Any questions, comments, drop them below. And of course, more importantly, share with a fellow ACLer that can benefit from these tips and education. So getting into some after surgery considerations, it's a little bit of an overwhelming day, right? You're showing up to the surgery center or the hospital very, very early in the morning. You may be waiting around for a couple hours before getting into surgery. Then once you get out, you're all groggy. You're given some instructions from the surgeon, and hopefully you have some support or a loved one with you that can understand some of this stuff while you're still kind of getting yourself together after anesthesia. And then you go home and probably will have a long list of questions come up, and at that point you'll be out of the office, out of the OR, and may not have access to your surgeon or your physical therapist if you haven't set that up yet. So a couple tips that you can go off of. Symptom expectation, right? Most importantly, what I want people to understand, no matter how you slice it, the arthroscopic surgery, it's more of a small portal sites and a small incision, it's still surgery. It's still considered major surgery. They're going to be shaving things. They're going to be drilling things. They're going to cut things out. They're going to put new things in. It's normal to have pain. It's expected to have pain. It's a normal response. Pain can linger for some for a few days to a week, 10 days. So this is expected. It's not pain from your injury. It's pain from the actual surgery. We call this post-op pain, and it's from the actual trauma of the surgery. So it is very, very common, very, very normal to have pain. So what do we do about it? Well, we have pain control. You want to follow the doctor's orders. They're going to prescribe pain medicines for you. Don't be afraid to take as prescribed. Now, I know some people are hesitant to be taking pain medications or don't like to take medicines because of the way it makes them feel, or possibly, the chance of being addicted to it. These are all okay, and I very, very much understand. At the same point, because of major surgery like this, we want you to know that it's okay to take pain medicine, because we want you to feel comfortable moving the knee. The sooner that we get the knee moving, the better you will end up feeling. But if you're in so much pain, you're so locked up, you're not going to want to move. So our recommendation here is take the medicine as prescribed and stay ahead of it. So this way you can start your rehab, your exercises the very next day. Next, incision and wound inspection. So things that we're looking out for, the major things, is basically signs of infection, right? Everyone heals a little differently. You do want to check your incisions every day. We want to make sure that we keep incisions dry and clean for up to 3 days. So you can leave, as far as when you come home, you're going to be sent home with a bunch of bandages and a dressing. It's okay to be able to take those off and rewrap or add a new dressing so things stay clean. We want to keep all incisions covered with gauze or padding, and make sure that on top of that, you're wrapping the knee, not only just kind of keep debris and the external life out of it, but also to keep some compression there, okay? As a tip that we recommend, you can take pictures of the progress daily, so this way you can see how things are healing and healing nicely. Big thing that we're obviously going to watch out for is a sign of infection. All right, what are we looking out for? Redness, swelling around the incision sites, warmth, more than usual. So it's okay for your knee to be warm. It just went through a surgery process, so it's very, very much normal to be more warm than the other leg. But we're talking about an increased warmth, almost like hot even, and a combination of increased swelling, especially around the incision sites, increased redness around those areas. And then the key big one is having a fever associated with all that stuff. So if you do find that you are having these signs, symptoms, very, very important to speak and just call the surgeon's office, let them know what's going on, and then let them make a decision. Always better to err on the side of caution here. Brace use. So some of you, especially in the States, will be sent home with a brace, a long leg brace. Some of our clients overseas and even some in the U.S. are getting away from using a brace after surgery. But if you are sent home with a brace immobilizer, it should be worn at all times. You should be wearing it based on the doctor's recommendations, and most definitely you should have it on when you're on your feet and when you're sleeping. However, a big thing that sometimes people forget is you can have this brace, this immobilizer off when you're doing your exercises. It's actually important. So this way you can get your knee moving. The brace may get in the way of that. So when you're sitting, you're laying down, you're home, nobody's around, you can take this brace off. It doesn't have to be on at all times. Really, the most important is when you're on your feet and when you're sleeping. Okay, speaking of sleep, a couple sleep tips. Really, sleep's going to suck for the first week. There's no way around that. A couple tips that can help. Sleeping on your back is probably going to be the most comfortable for you. And if you can get your leg elevated, that'd be a bonus to help with swelling control as well. What we do like to recommend is a wedge pillow. So they sell these like big triangular pillows on Amazon. They can help keep the leg elevated. So when we do elevate, we want to elevate from the heel all the way up to the foot and ankle. We never, ever, ever want to just put a pillow under the knee. We don't want a bent knee for a long period of time. So when you are laying down, when you are sleeping, you get one of those wedge pillows, triangle pillows, or you stack a bunch of long pillows up. And we want to make sure when you are elevating, you're elevating from your hip all the way towards your foot. Mostly back sleeping is probably going to be recommended and the easiest. If you do sleep on your side, good to keep a pillow in between your legs, because if you do have that long leg brace on, we don't want it irritating the other leg. And that's just kind of a way to keep some separation, some space there. As far as weight bearing goes, so if you had ACL surgery alone without any other procedures, you will be weight bearing as tolerated. If you had ACL surgery with, let's say, a meniscus cleanup, you still will be weight bearing as tolerated. If you had ACL surgery with a small meniscus repair, chances are you still be weight bearing as tolerated. Sometimes, depending on the size of the meniscus tear and the repair itself, the complications of the repair, you may have a weight bearing restriction. But if you're sent home, weight bearing is tolerated, that means you're gradually allowed to put weight through your leg. Most of the time, you'll be sent home with this long leg brace and with crutches. And if that's the case, utilize the crutches and the brace together. Take, as much as, yes, it's nice to put weight through the leg because that has some benefits. The knee's also been through a whole bunch of stuff. When we are weight bearing like that, we're going to cause more stress, and that's going to increase the swelling. So really for that first week, I say walk sparingly, right? We want to get off our feet, we want to get the leg elevated. But if you have to walk to use the bathroom or kind of navigate the house, that's all right. Use your crutches, use your brace, and put weight through it as you feel comfortable, as you see fit. But we don't want you standing and walking for long periods of time, especially that first week, because our job is to control swelling. As far as when we get to reduce the brace and crutch use, really is going to be dependent on, how's your motion coming along? Are you getting that full extension back? Are you getting some flexion back? And more importantly, is your quad muscle waking up and are you able to activate it? When you can demonstrate this stuff, what we call it is having good quad control. What we then start to do is progress you out of these things. So we may go from taking the brace off and just using 2 crutches, and then reducing to 1 crutch, and then finally getting rid of the 1 crutch. This could happen in a span anywhere from 2 weeks to 4 weeks to 6 weeks, depending on those factors, the motion itself and the quad coming back. And a big one is we want you to demonstrate a good gait pattern. So even if you have good quad control and if you have the available range, if you're not bending and straightening the leg and using the appropriate gait and you're kind of compensating or walking with a limp, this is still an issue. So recommendation would be to still use a crutch if you have to normalize your gait, to make it super, super clean before you get rid of the crutch itself. Shower guidelines. This will be dependent on your surgeon as well. It is important to keep incisions dry for 3 days, so we probably will not be showering for those 3 days. You can use like a sponge bath around the area, but we don't want to get the incisions wet, especially after they're healing. After about 3 days, we do recommend that you can take a shower, but what we want to do is, as far as, again, it shouldn't be soaking. The incision should not be soaking. They can gently warm water. We don't want to be scrubbing these areas because they'll still be very, very sensitive, as well as not fully scabbed or healing just yet. Never soak the leg, never a hot tub or a bath, pool, open water, anything like that until the incisions are fully healed and dry. And again, it'd be good to talk to your surgeon about the final clearance to submerge yourself in a body of water. As far as exercises should start day 1 after surgery if you can tolerate it. Really, when we get a client before surgery, we like to give them the game plan prior to. So this way they could review the exercises, what they should be doing, and then once after surgery they feel comfortable, we want to start. You don't have to start with a million things, but there's some few key basics that we do want to get started with. One is quad activation. We call these quad sets. It's basically a quad. You're just contracting your quad muscle with the leg being straight. This is the top exercise we recommend because that quad muscle is the most important to get going and wake up right away. What I will inform our clients is we want to do 10 of these for every waking hour. So you're contracting that muscle for anywhere from 3 to 5 seconds. You're going to perform 10 reps. And then every hour you should have a reminder on your phone to do those exercises. This is going to help activate the quad. This is also going to help get the leg nice and straight. Heel slides is just to get bending going. So this is as we're bending to tolerance. And again, it doesn't have to be super aggressive right away, but we want to make sure the knee can start to bend. Little by little as pain levels calm down, we want to take up the available range of motion. We also use ankle pumps early on, and this is just for to prevent any blood clots in the lower leg, calf area. So it's good to be pumping and using the leg, making sure that blood flow is circulating. And the last big piece, NMES, stands for neuromuscular electrical stimulation, or AKA muscle stim. Super important to be using this post-operatively. There's a lot of evidence to suggest that it is very beneficial, especially to wake up the quads. These are units that fortunately you can get online today, very accessible. Amazon has a whole bunch. There are some settings and parameters that are more beneficial than others, but using this in general would be very, very good for you, and it's something you should 100% put to use day 1 after surgery. And if you don't have a unit, you can reach out to us. We could recommend a unit and then show you the exact settings that we like to use. So I hope you found this, guys, helpful. Just some recommendations. I know you probably will get some recommendations from your surgeon itself, but we know that day can be overwhelming and it's just a lot. You're hit with a whole bunch. You may have some questions. So these are our tips and advice that we like to use post-operatively with our clients. And I have no doubt that you can find some value here. If you have some questions, drop them below. If you guys found value out of this video, please like it. Please subscribe to our channel. Most importantly, share with a fellow ACLer that can benefit with these videos. We drop one every Monday. This is Dr. Kaan signing off. I'll see you guys next week.